I am Melissa Carver, and the topic for my senior project is bedside shift reporting in the emergency department. What is bedside shift reporting? It is a process that allows nurses to involve our patients in their personal care plans by transferring care between shifts at the bedside. The objectives for this project include developing a standardized method for nurses to use during shift change. Once implemented, the effects of this process on patient satisfaction can be analyzed, and the goal is to improve the communication and information between the nurses and thereby reduce the risk for medical errors and adverse reactions for the patients. As nurses, we often develop routines and habits, have certain ways of doing things that make us sometimes hesitant to accept change. But it's important to remember that there are benefits that can be associated with change. In the case of bedside shift report, it helps us to focus our care around the patient. Patient involvement provides them with transparency in care and also ensures individualized care plans. It also helps to improve effective communication. Standardized formats can reduce the risk of miscommunication between both the offgoing and oncoming nurse. And it will also improve patient satisfaction scores, as patients will have a better understanding of their care plan and they can verify information at the bedside such as allergies and home medications, and therefore reduce the risk for adverse events. Can it work? Will implementing bedside shift report in the emergency department help to improve patient safety and quality of care compared to our current method of shift report? So let's take a look at both. Our current method generally takes place at the nurse's station, which is often prone to interruptions or distractions such as phone calls, other nurses, and even patients and family approaching the station to ask questions. This sometimes leads to lengthy shift reporting and often incomplete just due to the nature of distractions and not necessarily picking up where you left off. It also is only one-way communication between the nurses and does not involve the patient. On the other hand, bedside shift reporting takes place at the patient's bedside, so you have the privacy of the patient room, and sometimes an issue that can be of concern with bedside shift reporting is visitors or other family members in the room, and just by simply asking the patient prior to beginning the transfer of information, if it's appropriate for those people to remain in the room, or otherwise we can ask them to step out. It provides a standardized format that streamlines the process, and of course the patient is involved as they are present for the report. So when researching this topic, I found several statistics that were quite impressive to me. And the first one being that approximately 1 out of 4 patients reports not always being satisfied with the communication they have with their nurse. The Joint Commission reports that a leading cause of sentinel events is breakdown in communication. This breakdown in communication creates a risk for medical errors and adverse reactions. So, obviously, it's essential that effective communication be provided between the nurses and the patient to reduce those risks and improve the quality of care. So, one solution is bedside shift reporting. Growing up, my parents always said, you can't expect different outcomes if you don't do things in a different way. In the case of bedside shift reporting, if we want to improve that patient experience, we have to change the way we not only communicate with each other, but also with the patient. So in order to successfully implement this program, we would need educational sessions to be present, to have staff present and allow them the opportunity to address any questions or concerns or perceived barriers they may have to the process. We need to also give them the information and the statistics that show that it can work. And we'll certainly have to develop a standardized tool, which I would recommend be based on SBAR, so that that information is streamlined and accurate for each patient. So what can we do? We all know that nurses need to advocate for their patients. So by committing to advocate, we can include these patients in their care plans. And the number one thing that we all can do is have a positive attitude. We may not realize it, but the way we feel and the way we speak affects everybody in our department. And we need to support change and be positive to help our coworkers buy into new ideas as well. And expected outcomes for this process would be clear, concise, and effective communication during the bedside shift report. We will be providing patient-centered care that can minimize the risk of medical errors. And this is one way this is achieved is with both nurses and the patient in the room. The oncoming nurse can lay eyes on their patient at the same time giving report, and our patients can verify the information as well that's being transferred during that handoff care. It makes efficient use of the nurse's time. As I said earlier, the nurse lays eyes on their patient. All the things such as drip rates on the pump rates and everything are verified by both nurses and the patient. And it improves our sense of teamwork. We're working together and our patients see that. It helps, relieve some of their anxiety and helps develop a trusting relationship, and they feel that they're properly being cared for. Conclusion, of course, teamwork. We work together and we can implement bedside shift report, and both the patients and the nurses reap reports from this process. I welcome any comments or suggestions or questions about this, and hopefully this is something that can help our patients get that quality care that we all want them to have. Thank you.